ئەم ناڵەمان ماوەی 3 ساڵە نەخۆشە نەخۆشەکەی وەی کێشەی میزەڵانی هەیە ناتوانێت میزەکە باسن میزەکە لە ناو میزەڵانی ئەمایەوە زۆر دکتۆر گەڕای زۆر عیلازمان بەکارهێنا هیچ ئیسپادەیەکی نەبوو بەڵام سوپاس بۆ خوا لە ڕێی چەند کەسێکەوە ڕێگای هیندستان ماگرتە بەر و بۆ نەخۆشخانەی مەنیپاڵ بەتایبەتیش بۆ لای دکتۆر ڤیکاس الحەمدولیلا نەشتەگەریکی باشی بۆ ئەنجام دراوە سەرکەوتوو بوو ئێمە زۆر سپاسی دکتۆر ڤیکاس و ستافەکەی یەکەین و نەخۆشخانەکەکەین بەڕاستی ئیشێکی زۆر سەرکەوتووی کردو سپاسێکین سپاس بۆ خوا کە مناڵەکەمان ئێستا تەندروستی زۆر باشە.
Namaskar. My name is Dr. Vikas Jain. I am presently working as Head of the Department of Urology, Robotic Surgery and Kidney Transplantation from Manipal Hospital, Dwarka. So you just met a young, beautiful girl from Iraq, Lavin. So Lavin is just 10 years of age and she had come to me. The parents were really worried about her that she has not been able to pass urine since last 4 years. So young girls specifically, their urination and everything is very, very important. So if I tell you about her story, you will be really surprised that when she was in school, one of those days when she was 6 years old, she had some traumatic experience, some psychological trauma, because of which she went into a problem where we tell it as she was not comfortable in passing urine. So passing urine became a traumatic experience for her. The kind of trauma that she had, and she actually forgot to pass urine, and whenever she tried to pass urine, she was so scared that she somehow was not able to pass urine at all. And believe me, this is not an uncommon problem. We see young girls like her who are not able to pass urine because they are studying in a school where the proper toilets are not there, so they don't pass the urine the entire day. They go out and they don't find proper areas where they can pass urine in privacy. So this is common in young girls, and probably she had one of those incidents or traumatic experience that she was really scared to pass urine. And because of that, in the last 4 years, she has undergone multiple procedures. Somebody told her to pass a tube into her urinary passage and empty bladder every 3 to 4 hours. Sometimes her mother has been doing it, and sometimes she does it herself. And then after 2-3 years, maybe around 1 year back, somebody opened the urinary bladder to the external area so that she was continuously passing urine. There was, it was a continuous passage of urine, and she was wearing diapers since last 1.5 years. So what happens to these children? So she's just young, and if she continues to have an open bladder and continuous passage of urine, then the life is going to become very, very difficult for her. She is going to become an adult and she has to study and everything. So there will be a lot of social problems. So when they came to us, I counseled her that whatever had happened, and passing urine is a normal person, that everybody should does it. So out of lot of counseling, psychological support, and what we did is we closed her bladder. So as I told you that her bladder was open to the external environment, what we call as vesicostomy. I just did a small surgery like vesicostomy closure, where I just closed the bladder and make it normal for her. And once we removed the catheter after the surgery, it was not a major surgery. I won't say it's a complex surgery, but the entire situation or entire story is a complex one, because such a traumatic experience and somebody stops passing urine because of some scare or some traumatic experience. So after we remove the bladder and after we remove the catheter and after proper counseling, now she is able to pass urine normally. Look at the smile on her face. She is so happy. The parents are so happy that she is now as normal as us. Actually, she was actually normal. Only the problem was in her mindset and the wrong treatment that was given to her in her own country. So we just offered her good psychological support and a small procedure like vesicostomy closure, and she is now as normal as any one of us. So if you are dealing with such issues, you can definitely come to us at Manipal Hospital, Dwarka. We have got a very good team to look after all your urological and renal problems. Thank you so much for listening to us. Namaskar.